Hi everyone, this is Dr. Kusuma. I am not going to do a surgical video today. I want to do a more simpler video today because although I'm a plastic surgeon and do a lot of facial surgery and breast surgery, after face surgery, I typically recommend patients to allow me to manage their face for a short period of time so that the look I want from surgery matches what I do with other things, like, for example, Botox or skincare or something, for at least a short period of time until the patient is fully healed. And so it's not unusual, actually, it's common that after surgery, 2-3 weeks later, I typically do their Botox treatment after surgery. So to that effect, I wanted to talk about Botox and other neurotoxins or neuromodulators as part of my overall rejuvenation approach. Okay, so you may have heard this before, but I think it's worth discussing. So I just represented, right, eyes on both sides, the nose in the center, the lips here, the chin here, the neck here, and the cheeks here, generally speaking. So one of the things that we do is to try to modulate the function of all of these reddish areas that represent musculature of the face that are called mimetic muscles that allow the face to move. And the goal is to have your own expression where all of them move together in symmetrical fashion on both sides to allow you to have a normal, natural appearance. Whenever there's imbalance in the two, as happens in Bell's palsy, for example, where one side is not working properly, everything gets messed up. So one of the principal goals of this treatment is to obtain symmetry on both sides. Otherwise, the smile can get messed up, the brow can get messed up, etc. So what are all the areas that are treatable with Botox? So the number one area that we treat is what's called number 11s, right? This area here. That's because this muscle here that I represented, this muscle here, and these muscles here generally want to pull the facial skin inward like this. And this would want to pull the muscle downward like this. So that's why the space between here and here, between this muscle and this muscle that pulls down, can get a big groove, and that's the number 11 that is formed. When problem is mild, you can generally loosen or weaken these muscles with injections along the muscle. So you try to inject along the muscle of various ways people do it. You inject along the muscle like this. Sometimes people do it whatever number of ways. I don't want to go about the technique, but once you do this, this pull cannot happen because the muscle is now relaxed and essentially paralyzed. Therefore, the muscle becomes flaccid, and therefore it's not going to be able to pull this way or this way, and then that smooths out. Fairly simple, right? So the technique of this, you can understand, is close to the eye. So if this injection is too deep, you can paralyze the eye muscle and cause what we call ptosis. So that's one area that you can treat the number 11s always. And a lot of times people talk about doing it by units or by areas, and that's again something we don't have to go into, but that's the essential principle behind the treatment of the number 11s. The forehead I wrote here, but this is a flat muscle, okay? This is a flat muscle that goes all across the forehead, and the goal of this is, again, to raise your brow, like this. And this muscle complex comes and inserts down here. So every time you raise your brow, the brow wants to go up, and that's what the function of this muscle is. And so to weaken this, you want to, again, inject the forehead along the forehead in different places. Just remember, since this is trying to elevate and it's a very flat muscle, there's muscle fibers all across the entire forehead. So if you weaken and put injections along the muscle, whatever areas that are injected are going to become weak. But if you come too low where this inserts to the brow, too low, that can cause the brow to drop some, because now you're not able to have some chronic tone where the brow is kept in good position without even thinking about it. Subconsciously it happens. But if you come too low, it causes the brow to not elevate, and suddenly everybody feels like their brow is low, or the brow is dropped, or their brows are heavy, or their eyes are heavy, for example, right? So that's what happens in the forehead. So you have to pick the areas that you treat properly, and you have to be as symmetric as possible along both sides. So if you weaken all of this, but you still have function in this area, this still continues to elevate, and that can create some elevation of the corner of the brow while the middle part doesn't elevate. Hopefully that makes sense. Secondarily, this sphincteric or circular muscle is the eye muscle that causes your eye to close. And so the corner of this is where the crow's feet happen, right? So if you technically weaken this area, this relaxes and causes some softening of the sides of the eye. So now I told you that this elevates and this pulls down the brow area. So if this is stronger, the brow is going to go up. If this is stronger, the brow is going to come down. So when you inject these areas, you want to weaken this. So relatively speaking, the upward motion is stronger, and therefore the brow can go northward and makes it look like you got a nice peak or an arch. If you overdo it, it's going to become too high. If you underdo it, it's not going to do enough. And so it depends again how into the eye you want to go to create weakness so you raise the brow. You have to kind of think through this. And this is where the technique comes in. It's not necessarily the product that does the job. It's the technical injection that does the job. And if there's any asymmetry that develops, obviously you're going to have a little bit of difference in the symmetry of the eye. So one good way to manage this, if there is such an incident, is to have patients come back in a week or 10 days and necessarily tweak it. This doesn't happen often at all. It's rather rare, but every patient should be told that if there's an issue like that, it's a possibility that you could get asymmetry. And if that's the case, you have to come back and take care of it with adjusting the injection sites again. So you can see even a simple thing like Botox could also have issues, right? So, and if injection happens to be improperly done, then the longevity of it could be up to 1 month, 2 months, 3 months, sometimes even 4 months. But typically in these corner areas where there's a little bit of an issue, the dosing is fairly small. So hopefully it doesn't last as long in some sensitive areas like this. All right, so that's the injections of these sites. On the side of the nose, also there's muscles that causes the nose to have what we call bunny lines here. You can even weaken those by injecting that area as well, right? You can inject that also, so that softens this area here. One thing that you cannot fully correct is that the cheek muscle, when you smile, can kind of raise the cheek up as it pulls upward. When that happens, the skin naturally, bunches up here and causes what we call dynamic lines here. And those dynamic lines are going to be very, very, very hard to correct. You can correct the static lines along the side here like we just talked about, but it's very difficult or nearly impossible sometimes to correct the dynamic lines there, because every time the cheek moves up, all the skin bunches up and causes those lines that you cannot get rid of. So more injection there is not necessarily going to help too much, and you don't want to change their smile by weakening this either. That's going to mess them up, right? So that's the general principle behind the nose, around the eye, the center part of the eye, the forehead injections. So this area here is also interesting because this is also a circular muscle here. So when you want to do a lip lift here, essentially because this is a circular muscle, there's a chronic tone all around the lip to keep it together. But imagine injecting a little bit of product or Botox there. All of this is functioning as a sphincter or like a nice tone, but this relaxes. When this relaxes, this gives a little bit. So that kind of, in a sense, flips up, because it's a passive secondary effect, because all of this is still in a nice tone, so it keeps it nice and tight. But here, since you weaken this muscle here, this central part, if you weaken it, that loosens up and that causes the lip to look like it's a little bit wider and a little bit flipped up. So that's a lip flip area that you try to do. And you want to be, again, very minimal and very, very even on both sides, because you don't want to have, difference there. But it can happen, right? It's an injection, it's the pressure, it's the amount of units that you put in. It's not a precise robotic thing, it's a very human thing. So sometimes there could be a slight difference. Similarly here, if there's the corners of the mouth are downturned, there's this muscle that kind of pulls the corners down. So if you slightly weaken it, this muscle here, it doesn't pull down anymore. It can kind of make the corners a little bit more even and straight across like this. But imagine having that injection differential where there's not equal amounts and not in the same spot. That can also cause unevenness and that can mess up the smile. You can even sometimes have this diffuse occasionally to muscles where you don't want to diffuse. So it can happen. It can happen to anybody, any injector. When that happens, sometimes the smile could be crooked. So it's a tricky thing. And occasionally, despite your best efforts, you can have some slight asymmetry. But the amount of product that's put there is so minimal that the effect of that asymmetry should hopefully be no more than 2-3 weeks, but it's still distressing to have it, and it's completely understandable. And so that is the tricky part of injecting it, because you may have some slight asymmetry. You can also create improvement in the chin dimpling by injecting the chin area also. So you can inject the chin area, and clearly when you do that, some people have that orange peel look of the chin that can also soften up and make that better. You can inject the neck muscles here as well, like I drew out, called the platysma muscle, that can create some softening of the bands. You can even soften the width of the mouth by injecting this muscle called the masseter muscle, which is along the sides. And when that's weaker, it generally softens up a little bit right there. So you can see, you can really contour the whole face with Botox injections without any surgery. That can make a nice, soft, subtle change in the face and how you appear. But the trick is, it's really not necessarily the product so much, it's really the injector, where there could be some mild asymmetry very, very rarely, but most of the time you get a very consistent look, especially if you treat somebody for a period of time. You can understand how much dosing to put, where to put it, because again, not everybody is the same. There could be some asymmetry in their muscle function, their muscle weakness. Sometimes half of the face is better developed than the other part of the face, and so there's a lot of nuances. But I do this injection, and I like doing it a lot, because when I do surgery, I want to make sure that all of the improvements that have been brought about by surgery are not changed or disrupted, so that the patient has a great outcome, at least for the peri-operative period around the time of surgery. After that, typically they come to me, or they go to whoever they used to go to, which is perfectly fine. So that's why I want to kind of just go over a very brief overview of Botox and other neurotoxin injectors. So how many types of products are there right now in the market? There's Botox, there's Dysport, there's Jeuveau, there is what we call Daxify, and maybe there's one or two others, but in my office I typically use these two the most, Dysport and Botox. This one supposedly is going to last a long period of time, but I tried it a couple of times, but I still stick to these two the most. I don't necessarily use Jeuveau, but again, people get used to what they use and they all work, but I just happen to use Botox and Dysport in my office. So hopefully this will give you some idea of Botox injections and Dysport injections, and generally speaking neurotoxin or neuromodulator injections for your reference. If you have any questions, hopefully this will clear it up. Thank you.